The second workforce partnership we're recognizing today is the Healthcare Training Institute in Boston, Massachusetts. Since 2009, it has operated an impressive pre-college prep program with new services and career pathways for both incumbent workers and retooled its reemployment training programs to better meet employer needs. In addition, after proving the value of its services, the partnership has successfully brought in new investment from its employer partners. The partnership has surpassed or is on track to reach its goal in all areas, including enrollment, wage gains, promotions, placements, and enrollment in post-secondary education and training. Finally, this partnership is an exemplary learning organization, constantly reviewing and refining its program and services, using its employer advisory committee to improve and inform its work and spread systems changes within the healthcare industry. The HTI has served 386 participants, with 73 receiving credentials and degrees. HTI has surpassed its goal of 100 participants receiving wage increases, and currently 213 participants have earned raises. Will Losi Leung of SkillWorks and Carol Grady of JVS Boston please come up to accept your award?
Thank you. Thank you very much. It's terrific to be here. I have to say, on behalf of JVS Boston, the Healthcare Training Institute, our fantastic employers, and our innovative funder and SkillWorks, we couldn't be more thrilled to be honored. As I thought about what I might say, I thought, geez, how can I detail absolutely everything we've done over the last 3.5 years so you really understand how great it is to be on this stage? But Losi reminded me I have 3 minutes. So I'd love to tell you about our outcomes. I'd love to tell you about our innovations and our system change. Come see me if you want to hear what's happened to over 1,200 employees. I'm happy to share that. But really what today is about is our partnership. In the Healthcare Training Institute, it's not just JVS and some employers. It is really an employer-driven partnership. And I know you've heard that today, and I have to say, as I sat here and in the session earlier, I don't think 6 years ago that's what I heard. I had come from the employer side into workforce development, and I didn't hear employer, employer, employer. And now I do, and I have to say it's great to be a part of what I believe is the way that we need to work with our entry-level employers through the employer need model. Our employers are Beth Israel Deaconess Medical Center, and I have to say these out loud because these are fantastic partners. Brigham and Women's Hospital, Children's Hospital, Hebrew Senior Life, and our partners included in the Healthcare Training Institute are also Mass Bay Community College, Bunker Hill Community College, Mass General Hospital, and of course SkillWorks. And we do see that as our entire partnership. One of the things that I need to tell you is that our vision is to really go hand in hand with the employers, to understand deeply what their needs are and to assist them in reaching their goals. One of our employer partners has agreed to come up and say a couple of words, which I'm thrilled about, but I can't leave without saying the consistent, flexible, and supportive funding that we receive makes it all possible. My colleague Losi from SkillWorks and the National Fund are really what support our work. So I thank you for this. And Joanne, if you want to say a couple of words.
So I'm speaking on behalf of the 6 employers involved in the Healthcare Training Institute, and I want to thank JVS for brokering our collaboration, innovating with us, listening and advising, and we all come to the table saying, how do we do this better? How do we do this better? And that's one of the best parts of this collaboration is we don't stop at, oh, this was kind of good. We always are thinking about the next way of improving. I also want to thank SkillWorks and the funders for providing a really flexible model of funding, understanding that we all have different needs as employers, and seeing employers as a partner in this process. Their large-scale investment, and also their policy advocacy work. They also think, how can we do this better, and how do we help the city and the state do this better so we can do better work? So I'm delighted to be sort of in such good company in this collaboration. Thanks.